The corresponding analogues are selected in the dental laboratory. When repositioning the analogues, care must be taken to ensure that their shoulders snap firmly into place. A gingival mask should always be used to achieve an optimal cervical crown contour. The working model is created, as usual, using dental stone. These are the completed working models with the 3 implant analogues and the gingival mask. After checking the clinical situation on an articulator, abutments can now be selected. For this purpose, a special prosthetic planning kit is available to dental technicians to facilitate the choice of the correct components and to keep inventory levels at a minimum. This planning kit includes plastic try-in abutments for crowns and bridges that can be placed on the implant analogues to verify their heights and axial inclinations. First, the dental technician hand tightens the Synocta cemented abutments in place on the analogues using the SCS screwdriver. Care must be taken to ensure that the abutment is placed within the octagon of the analogue. Now the clinical situation is reviewed on the articulator and, if necessary, as in this case, the occlusal distance is corrected by reducing the length of the abutments. The dental technician can subsequently use prefabricated parts for creating the superstructure. In this case, castable Synocta burnout plastic copings for crowns were placed on the shortened abutments by pressing until the caps clicked into place. These caps are cut in height as required. Once this is done, the crown framework is waxed up as usual according to standard veneering techniques. Once completed, the superstructure model is invested. After the initial casting, the snap-on mechanism must be removed with the reamer before placing the casting on the analogues. After core firing, the casting is veneered following anatomical guidelines. This is followed by main firing, correction firing, and glaze firing. These are the finished porcelain fused to metal crowns. They can be seated on the analogues without the slightest tension. To ensure correct transfer of the positions of the Synocta cemented abutment from the working cast to the patient in the dental office, a transfer aid can be used. It's made of plastic, can be attached by polymerization, and can be slid onto the Synocta cemented abutment. A resin index is created on the working cast in order to transfer the abutments to the patient. The structure is handed over to the dentist with the custom-reduced Synocta cemented abutments on the working model.